I thought that I would make a video talking about Ehlers Danlos syndrome and hypermobility spectrum disorder, and just kind of do like videos talking about how do I know I have hypermobility, or how do I know I have EDS, because, or how do I know I have, this condition or that condition, because I thought I would do this because when I was in my flare-ups at the beginning of my journey, before I had answers, which took me a long time to get, I was really scared, and I had no idea what was going on with my body. I didn't know what was wrong with me. I was very overwhelmed, just really gaslit as well, by the medical community and even by myself. I started to think, maybe I was just crazy. Maybe it was just anxiety. Maybe it was just in my head. Um, and I didn't understand that, I actually had serious conditions that I was living with. And it's just that they weren't very well understood or recognized within the medical community. And so I wanted to share what would have been helpful to me to come across, in case there's somebody out there like me who is in a place where you are bedridden, or you are in some sort of an extreme flare up trying to figure out, what's going on. So in this video, I'm going to talk about specifically about hypermobility spectrum disorder and Ehlers-Danlos, and just kind of give what information I know or that I've learned on it. I am not an expert, so there's probably a lot that I am missing or not getting, not remembering to put in here, but I'm going to just try to, talk about what I know and what I've learned so far. So Ehlers-Danlos syndrome is part of a spectrum of hypermobile disorders. It is on the very severe end. It's the most severe type of hypermobile spectrum disorder that you can have. There is like a benign hypermobility disorder towards, I think, the other end, where you're just flexible, but it doesn't cause you pain. It doesn't affect you systemically, nothing like that. So it's just basically just you're a little flexible. And then in the middle, there's varying degrees of, severity and how they affect people and what is all impacted within the body. That is what I gather from it. I was told that when I went to go and see the specialist that I ended up seeing, I was told that a lot of people nowadays are being diagnosed with just generalized hypermobility spectrum disorder, which is right below the diagnosis of Ehlers-Danlos. And that is what I was told that I have, is generalized hypermobility spectrum disorder. I am in the process of seeing like an actual EDS specialist. I've been on a wait list for a very long time, and that is to my gathering and understanding at least, it is a very common thing with this condition, is that there's not a lot of specialists that you can see. There's not a lot of specialists that can diagnose this condition. It's really hard for a lot of people to be diagnosed because it is so hard to find medical professionals that can actually do that. And if you are fortunate enough to be close enough to one or find one, the wait lists are astronomical. It's almost unreal how long you have to be on a wait list in order to be seen. And I think that just kind of tells you like how sad it is that this is actually not that rare. It's just that there's not a whole lot of help out there to, diagnose and help manage these conditions. There is no treatment for EDS. There is no treatment for hypermobility. It's something that is, to my understanding, lifelong. I've seen videos lately on here where people are saying, oh, I cured, my POTS and my mast cell and my EDS. And I can see how maybe you can find some sort of a remission with mast cell and POTS, but when it comes to EDS or hypermobility, that's lifelong. You're not just going to all of a sudden stop being able to hyperextend your joints and the collagen in your body is just going to miraculously like just be normal. That's, to me, that just doesn't make sense, I guess. But maybe somewhere out there, somebody is in some sort of a remission. I don't know. But so to my understanding, it is lifelong. This is something that you're born with. It's something that, just it causes your collagen within your body to be faulty. It causes it to not work properly. And the primary symptoms of it are joint hyperextensibility. It affects your skin, easy bruising. A lot of people with EDS have skin that is hyperextensible. You can stretch it pretty far, like it's a little more stretchy than, I guess your typical person. I do not have like extremely stretchy skin, but I would say it is a little more stretchy than, I guess, your typical person. I do have very stretchy like eyelids. So I thought that mine was normal in that regard, but when I would ask people around me, like, can you do this, and can you like stretch your skin like that, and they would try to do it, they would be like, no, that's not normal. Like, I can't do that. So then that was something that I recognized I have, and it causes pain for most people that have it, because your joints are very unstable because of the lack of collagen and the lack of support that they have from like surrounding tissues and stuff. So you will experience a lot of dislocations or subluxations. For me, I have experienced dislocations in my life, but I have more so experienced subluxations, which I do daily. I have multiple joints subluxed at one time, pretty much always. The worst joints for me are in my shoulders, in my back, in my neck, and my fingers. And my knees and my hips as well. So I guess I have a lot of them, but yeah, there's a lot of just like subluxations and dislocations. And I think that it's kind of, when you read about it and when you learn about it, you think, well, it basically impacts your joints and affects like your skin. And that's, it, but it's not, because the collagen isn't just present in your skin and, and affects your joints. It also impacts and affects your collagen within your body. So it's going to cause symptoms like acid reflux. It's going to cause constipation, chronic constipation. It can cause heart issues, a variety of symptoms, because that collagen is faulty, and when it doesn't function properly, you get a bunch of issues because it's too stretchy. Digestion is slowed down. So that is a cause for a lot of digestive issues and acid reflux within people who are hypermobile. And I found that to be really interesting when I learned that, because that explained a lot of my issues and why I was experiencing what I was throughout my life. So yeah, I was told that the diagnosis that a lot of people are receiving right now is generalized hypermobility spectrum disorder, because they changed the criteria in 2017 to be diagnosed with Ehlers Danlos, because they're currently looking for a specific genetic mutation so that they can figure out like what is at the root, like what is causing hypermobile EDS for people. They have the genetic component to a lot of other types of EDS, which there are other types of EDS that aren't hypermobile, like vascular EDS. I think that one affects your heart. classical EDS. I think that's more of the skin symptoms where people have like really stretchy skin. And so I'm not 100% sure, I could be kind of wrong on some of these, but to my understanding, that is what I've learned. And for those types of EDS, there is a genetic mutation found, so it can be detected through like genetic testing and blood work and labs and all of that. But for the hypermobile EDS, that genetic component isn't found yet. So they're trying really hard to find it, and because of that, they're only diagnosing like certain people, and the majority of people who technically have EDS are being sent away with a generalized hypermobility spectrum disorder diagnosis. And I was told it's the same thing, like it's the same symptoms, it's the same thing, but that is what I have been through and learned so far. And I think right here I will add some pictures showing my own personal hands and the hyperextensibility of my hands, and then also family members of mine who also have hypermobility, and what it looks like kind of to have generalized hypermobility spectrum disorder, or EDS. And then I also will add a picture of the Baton scale that you can do yourself at home to kind of get an understanding of your own flexibility and hyperextensibility of your joints, and the criteria that is used to diagnose Ehlers Danlos. And I think, if you're somebody who feels like you check off all of the boxes when you check yourself on that scale, and you have debilitating symptoms that it's impacting the way that you function daily, to advocate for yourself in getting a diagnosis or trying to find, somebody that can diagnose it near you, it is, like I said, very hard to do. But I think it's worth it because this condition is really hard. It's disabling to a lot of people. It causes a lot of pain. It causes you to, at times, not be able to function like other people do. And so I just wanted to share that in case it can be helpful to somebody else. So I'm going to share the Baton scale. And there's a lot more that I could say about this condition. I was sitting kind of weird, my leg is falling asleep, so trying to fix that. But there's a lot that I'm probably missing. There's a lot that I'm probably not covering here about Ehlers Danlos, but it's often comorbid with dysautonomia. So that is also what I was diagnosed with, and I'll talk about that in another video. And mast cell activation disorder, which I also was diagnosed with, and I'll talk about that in a separate video as well. And it also has other conditions that can be connected to it. And for some reason, it seems to be something that is common within neurodivergent people, particularly ADHD and autism, which is fascinating. And, I'm not really sure why that is, but it is interesting to learn that and see the prevalence of it, I guess. But how I discovered that I am hypermobile, and that I am and that I actually was able to get the diagnosis that I received, was when I was in the middle of my first really bad POTS flare up, which would have been in 2022. And I was working at an assisted living facility, which required me to do a lot of physical labor. And I loved it. I loved working there. I loved that job, and I loved the people. And I was really sad because my body just was giving out on me. I was not able to keep up with what was required physically to do. And it was the first time, I mean, I've had other jobs and other things that I wasn't able to keep because I also had symptoms and pain and all of that, but not quite to this extent. Like, for example, I'm a cosmetologist. I had finished cosmetology school, and that was agonizing for me. If, I'm being honest, I remember I would often go downstairs into like the little area where there was like the meeting area where you would eat lunch and stuff, and that is where I would spend most of my days laying down, because when I would be on the floor, like where you take clients and stuff, my feet would hurt me so bad. It was horrible. My back would just be burning and tingling, and it would be horrible. Um, so I dreaded it, and I knew it wasn't something that I could do for the rest of my life, because I remember one time having to go to the urgent care because my heel got so bad. I thought that I broke it or something because it was so painful, but I can't remember what was wrong with it exactly. But it was some kind of something. And at the time, it was the hypermobility. At the time, it was um, the EDS, and I had no idea. But in 2022, I ended up at the assisted living facility. The first symptoms that I felt were in my feet. So when I say I had foot pain, pain is an understatement. I am surprised that I was able to walk, to be honest. I am surprised that I was able to carry on. I remember trying to go to Target to pick out some like inserts for my shoes. And I remember on the way in there, like I got out of my vehicle, and it was like I had to prepare myself and try to like give myself a pep talk on the way in there, because I did not want to put my feet on the ground when I was about to get out of the vehicle to go into the store. And when I did put my feet down, it was just instant agony. So I remember just walking in there, trying to walk in there the best that I could. It was like the kind of pain where like you clench like all of your muscles because you're like bracing for, just the worst of the worst. And I got some inserts for my shoes that helped. So they did help me. But it took like, I would say, 2 weeks before my feet started to feel like they went back to normal. And part of my hypermobility diagnosis, my feet were checked, because a common symptom of people who have EDS and hypermobile EDS is flat feet. And in your heels, if you are standing, I will try to post a picture of it like right here. So if you're standing, you have these little fat nodules that can be in your heels. They look like little balls, and that is part of the connective tissue that is like malfunctioning or whatever. And that's a common symptom in people who have hypermobility or EDS. And so I have those, and they, marked that down as part of the diagnostic process for me. Also, when I was working at that time at the assisted living facility, I had been experiencing severe back pain, horrendous back pain, and it was unlike any other back pain and I've had back pain like pretty bad, but it was the worst I've ever experienced it. And it was like a sharp, like a stabbing pain. I couldn't really bend in certain ways. I couldn't even sit in certain ways, and just agonizing. and I went to the doctor for it. At the same time, my ribs in the middle were like popping and cracking, and you could audibly hear my ribs like crack and pop. Especially if I went to go stretch my arms out like this, it would just my rib cage would just pop and crack. Um, and it felt like I had one of my ribs that was like getting caught or like slipping underneath the other, and excruciating. So I went to my doctor. I was like, I am trying to work. I am, trying to function, and I can't. I am in excruciating pain. I don't know what's happening. And he was like, well, I think that it's something called costochondritis, where you have like inflammation in your rib cage, and I'm going to prescribe you a really strong anti-inflammatory, like an NSAID. I did not take that, and I'm thankful that I didn't take it, because NSAIDs are really bad for mast cell and for hypermobility. It's just, it ends up making things worse, actually. I'm pretty sure. I read something somewhere that says that. Um, I didn't feel comfortable with the side effects of that medication, and I also didn't feel comfortable with the potency of it, I guess. But I remember just trying like biofreeze. I think maybe Tylenol I might have tried, and just a lot of rest. I tried to just stay in one place. It got so bad that I couldn't drive because I wasn't, and I had this thing that kept happening with something in my neck where when I would be driving, I couldn't turn to look like over my shoulder one way, because it was like my head only would move to like a certain place, and that was the limit that I could go, because if I tried to turn it anymore, it was just horrible. I couldn't turn it anymore, basically. I thought that maybe I needed to go to a chiropractor. So I went to the chiropractor. He cracked my back and my neck, and then sent me on my way. I felt a couple hours later like I was coming down with the flu. I felt like I was like achy, like I had a fever. I just felt really sick. I didn't feel good. And to my understanding, that can happen after a chiropractic adjustment. It's like something releasing from your body. But for me, it was really uncomfortable given the state that I was already in. I tried to go back one other time to have an adjustment, and it made it worse, because after the second time I went back to work, and I remember trying to do something, and it just was like a stabbing in my back, and I was like, I cannot do this. So I told the chiropractor, like, I don't feel comfortable doing this, because instead of it making it better, it's making it worse. And he actually didn't have very good like bedside manners, I would say. He was really upset that I wasn't going to allow him to finish the adjustments or anything like that, and started raising his voice at me and telling me that I had to, that I needed to, and I was out. I was like, no. So that was it for me. So I left, and I did not go back there. I did not go back to I haven't been to a chiropractor since then, and it's kind of sad, because I've been to chiropractors that are very good. So I know it's not like, that's not the experience typically, but for me, it was just, it was enough pain for me at that time to make me hesitant to go back. I was still not, having any answers. Right around this time, I was raking out in my, not at this time that I was experiencing the pain, but shortly before I started experiencing the pain, I was in my yard area raking the leaves, because it was turning from spring to summer, and I wanted to start planting like a garden with some vegetables and stuff like that. So I was raking my leaves, which I did every year, and I told myself, okay, I basically had it all done. And I was like, all right, I'm going to go inside and I'm going to rest a little bit and then come back out and finish it tomorrow. But the way that I am, when I get really focused on something, I feel like I have to finish it like then. Like I don't want to wait to do it, especially if it's something I want to do and I'm excited about. So I was really determined to just have that done so then I could start planting my garden and all of that. So I went out to go finish raking the leaves, and when I was raking, all of a sudden something in my shoulder popped, and it was the loudest pop I had ever heard come from my arm or my shoulder area. It was loud enough and I felt it, like I could actually feel something like pop, that I was scared that I ruptured like an artery or like a tendon or something. I didn't know what exactly I did. I didn't know what happened. From the sound of it and the feel of it, it felt like it was going to turn into something excruciatingly painful. So I stopped. I knew that it wasn't smart for me to continue after that point. And I put the rake away and I went inside and I filled the bathtub and I soaked my shoulder under the water to try to get it to relax a little bit so that hopefully the next day it wasn't bad. And thankfully, I don't know how, but it really wasn't bad. The next day, it was just a scary sounding and feeling experience, I guess. Um, so after that, it was like probably a couple weeks after that that I started to experience a lot of pain, like in my back from at work and in my feet as well. Um, it was suggested that I have an MRI at that time. I had never had an MRI in my life. The anxiety that I felt around it was astronomical. Like I did not feel like I could really do that with my anxiety. I did end up having one done quite a few months later. So, right at the verge of feeling like I was pretty much fully healed, I had an MRI. What the MRI would have shown if I would have had it when I was more symptomatic months earlier probably would have been a lot different, I think, than what was shown like months later, like when I was, almost not really symptomatic anymore. But through that MRI, it was shown that I had um, 2 discs out in my neck and 2 discs out in, I think it was the um, T something area. I don't know, my thoracic spine basically. Um, and I had some stenosis in my spine, and I had a bone island, they said, on one part of my spine. But other than that, they couldn't see anything. Other than that, everything looked fine. And to my understanding, they looked at my head, like my brain, my cervical area, my thoracic area. They did not check my lumbar area. But that was what they discovered through the MRI months later. Like I said, like when I was pretty much almost non-symptomatic. And so still didn't have a whole lot of answers, but when I was in the process of just like all this pain, all of this, confusion and what was going on with me exactly, I was trying to research and trying to figure out what was wrong with me, because I knew this wasn't normal. Nobody else I knew could not do these things because of these things that were happening to me. Yeah, they might have had some back pain. Yeah, they might have had some like foot pain or something, but it wasn't like it was something that continued on. It was something that for them happened. They rested, they took some medication, and they could go back and do that same thing again. And, they might have flare ups here and there, but it wasn't like a continual thing like for them. And for me, it was. And I was like, what the heck? That's just to me, it just didn't feel normal. Um, in terms of my childhood and like how this showed up in my childhood, what my childhood was like with this condition, I believe that this condition is what caused severe digestive issues for me from the very start of my life. And I believe that that is like at the root of my um, digestive issues. So I was definitely affected in that kind of a way. I was a very flexible kid. I was in a lot of sports. I was in basketball, soccer. I loved track and field. I did I did dance. I did gymnastics for a little bit. I had a trampoline, and I would do backflips. I would constantly be doing flips and cartwheels. I would twist myself up into like a pretzel, and my mom would think it was funny and like take pictures of me because I would literally like just contort myself into, um, different ways. I would turn my arm like completely around, all the way around. I would be bending. My joints would crack all the time, like my knuckles, my back, my neck. Without me even trying, I would just kind of turn and it would all just crack. Um, with my knuckles, I remember people telling me, don't do that because you're going to regret it. When you get older, you're going to get arthritis and, don't crack your knuckles, basically. But I couldn't help it. It was just something that happened. Um, I remember it was really easy for me to um, do certain things. Like at our park, we had um, this swing set type thing where there was a bell at the top. And if you climbed it and reached the top of the bell, you could like ring the bell. And a lot of people, tried it and they just couldn't do it. But I, with no effort, would just shimmy right up there and ring the bell. And I remember my mom being able to do it too, but she didn't really want to because she didn't want the attention or the focus on her. But yeah, I remember that was something that I loved to do as well. I was like a little monkey. I was climbing everywhere. I had favorite trees that I would go up in and like swing up, swing my legs up and just kind of go all over up into the tree. So I was very flexible. I was very adventurous. I enjoyed a lot of sports. I liked basketball probably the most, and I was pretty decent at it, I would say. I also really liked the long jump and the hurdles and the 55-meter dash, I think it was, in track and field. And I often would get either first or second place. So I excelled in certain areas athletically, I would say. And I was just really flexible, very bendy, and I was told often I was double jointed. So I can only recall one time as a young child having an some kind of like an injury to my joints or to my bones, and that was when I was in a car with my cousin and we were sitting in the back seat. I had to be around like 4 or 5, and he had wanted to give me something called a snake bite, where he took my arm and like twisted it a little bit, and I don't know, it must have been something that boys were doing around that time. And so he did that, but when he did it, he broke my arm. And I remember I had to go get a cast, and I had a pink cast on. And then when I got it off, I remember my arm looking really weird and like small. But then I recall in my teen years, I stopped being, I didn't stop being as flexible, but I stopped being as able to do the like sports and the extracurricular things that I used to do, because all of a sudden after puberty, the fatigue hit me really bad. And that's also a symptom of hypermobility is fatigue, and it was debilitating. So people looked at it mostly as depression. They didn't really see it for what it was. They didn't have, I think, any way to really connect the dots, like that oh, she has this and that is why she's feeling so like achy and fatigued. But that is what was going on for me. So I would say around like the age of 14, it just kind of, I was like a nosedive. Like I just, my energy, my ability to really, and I'm not saying like I completely lost like all ability to do sports and things like that, but I had a loss in ability to remain at the same kind of energy and consistency that I had when I was younger. um, and so then I had, I'm trying to think, oh, I had my first dislocation around the age of like 15. I was outside and it was kind of icy outside. And I was with my grandma, I remember, and I fell. And to brace myself, I kind of put my arm out so that I wouldn't just fall, like, on the ground or whatever. And I didn't fall really hard or anything like that. I just kind of came down. And when I did, my shoulder dislocated. And at first, my grandma didn't know what was happening or what went on for me. So I think that she just kind of thought that it would resolve on its own. And a week went by and I still, like, it was in excruciating pain, agonizing. So she took me to her chiropractor and they popped it back into place and it felt better. So that was my first dislocation. I had another instance, I would say in my early 20s, where I had somebody take my arm and kind of like pull it behind my back. And when that happened, the same shoulder sublux to the point where it was like probably almost a dislocation. I couldn't raise my arm above my head or anything like that, so I had to go to the emergency room. I can't remember exactly what they did for it, but after a few weeks it started to feel better. And then I had one instance when I was in my I would say like my mid 20s. I decided to do an exercise program, and I was exercising in my living room and I wasn't wearing shoes. So I just had my bare feet, which probably wasn't the best idea. And I dislocated my ankle. So I had to get like a brace and I walked around just hobbling everywhere for a long time until it went back into place. I'm not really sure what's going on with me right now. But yeah, so that was uh, something that had happened with my ankle. And then I had a lot of hip issues, and I still do. So it doesn't take much for my hips to pop and crack and come out of place and come out of their socket. I often will have to kind of move my leg around to kind of get it back into the spot that it's supposed to be in. And yeah, so I just thought that I would share a little bit about my experience, my journey, how I discovered that I had hypermobility. I really had to advocate for myself because this isn't something that somebody suggested to me. This isn't something that somebody was like, I think that you have EDS or I think you have hypermobility. This was something that I stumbled upon myself, and based on the connection to other things that I was experiencing and based on me trying to do the Baton scale and everything, I realized I have this. And then upon asking my family members about it and seeing that they also were able to hyperextend, and they also had the same kind of like systemic issues going on. I was like, okay, this is genetic. This is something that we have. And so with these conditions, I think that sometimes you have to really advocate. You can't wait for a doctor to tell you, you know, we think that this is what you have. Because if you do that, you might go your entire life and never end up being diagnosed or accurately diagnosed with um, this condition. And so I just wanted to share my story and share the information that I've learned so that potentially somebody else out there can find it helpful and useful. And yeah, so that's it for this one. And there's so much that I'm probably missing, but I just thought that I would give like a quick overview of what I've learned and what I know.